Hi, my name is Vijeesh Mohan. I am one of the nurses working in this medical ward. I will be taking care of you today. Doing the hand washing doing the general check, lighting, ventilation, checking the bed for locks, and checking the suction, oxygen, IV lines. Hi, today we are going to do the respiratory assessment. Before proceeding with the assessment, would you please tell me your name? Bob, is that your first name? Okay. And what's your last name? James. Okay. How would you like me to address you? Bob. Okay, Bob. Can you please tell me what is your date of birth? Okay. Do you have any allergy to any kind of food or medication? Okay. Okay, Bob. Today, now I am going to do the respiratory assessment. It will take around 20 to 40 minutes. Is that okay? Okay. While do the assessment, if you have any discomfort, you can tell me. Before proceeding with the assessment, I would like to ask you some questions. Do you have any history of respiratory disease? What I mean, like tuberculosis, it is a lung disease, and pneumonia, bronchitis, asthma, COPD. Do you have any history of this illness? No? Okay. And do you have any history of any kind of surgeries? Okay. So would you please tell me where do you work? So you're working in office. Why do you ask that question? Some people work in the coal mines or in the factories or in other that might have the exposure to dust that might lead to some allergy or asthma or COPD. Okay. Do you have any chest pain? Recently, you experienced any kind of chest pain? No. So how is your sleeping pattern? How well you sleep at night? You're doing well. How many pillows you are doing while you sleep? Okay. Do you experience any kind of chest pain after doing exercise or after walking for a long distance or after doing lifting something? Do you experience any kind of chest pain? No. Okay. And one more last question I need to ask: while you climb or doing your daily living, the activities of daily living, do you experience any kind of tiredness or exacerbation? No. Okay. Now I'm going to do the inspection. Uh, First, I am as a part of the respiratory assessment. While doing the inspection, I am inspecting the patient face. In the face, I am mainly inspecting the patient nose, the tip of the nose, and for the nasal flaring. If the patient has any difficulty in breathing, he might have a nasal flaring. Also, lips for any cyanosis that shows the patient is in decreased oxygen supply, and the earlobes that shows any kind of cyanosis or bruise discoloration, or also examining the neck for any kind of bruises, any scars, or any cuts. So that's about inspection. Then comes to the chest. Uh, in the chest mainly we are looking for the shape of the chest, whether it is flat, round, or barrels. For example, if patient have asthma, the patient have a barrel shaped chest, and some people have malnourished, they might have a pigeon, like pigeon chest. Also look for any cyanosis of the chest, any discolorations in the chest, any kind of moles or pigmentations in the chest. Also, if it is a female patient, I will lift her both breasts to see any rash or breakdown under the breast. So that's about the inspection. Mainly, we are looking for the symmetry and shape and in the inspection of the chest. Also, one important part of the inspection is we are analyzing the breathing pattern. For example, how many breaths per minute, and whether it is depth of whether it is shallow or deep, and the pattern of breath, whether it is like bradypnea or tachypnea, or the patient is having any cosmal breathing. So all these kind of things also we inspect during the inspection. So next is we are going to I am going to do the palpation. The palpation start with the neck. In the neck, when we are searching for the mass, so we have to do the light palpation in the neck. Light palpation in the neck, light palpation in the neck, and for mainly we are searching for any masses, lumps, and palpating the trachea. And if it is a male, we are like the atom sample, and for the symmetry of the neck. Then following that, and also we have to palpate the lymph nodes under the jawline. We have to palpate under the jawline. Then under in the clavicle there is a lymph node under the clavicle. Also in the axilla we have a lymph node. And then palpate the then we have to do the light palpation for lumps, swelling, and back of the hand for any temperature and moisture. And mainly, Bob, just can you please tell me when I am palpating if we have any pain? Please let me know, or tenderness, please let me know. So we are palpating for tenderness and masses and in the pain, any kind of that. And another thing, while we palpate, we search for crepitus sounds. It's a vibration we can felt if there is an abnormal air entry. That's crepitus sound. And also, we also use the tactile thermometers. So I will demo a tactile thermometer. So we can hold the patient chest like this. Then we can ask the patient to say 99. Bob, can you repeat 99? 99. One more time, 99. 99. One more time, 99. 99. So this is the palpation. We are checking the tactile thermometers that shows the normal vibration when the sounds of the chest wall. Now I am moving with the percussion. Percussion also we usually have 4 types of sound that shows the abnormalities. Like we have resonant sound, we have resonant sound, dull sound, and tympanic sound. Usually, when we do the percussion, we can do the percussion like this. So when we percuss on the clavicle region, we will hear a tympanic sound or a resonant sound. We can hear a resonant sound in the clavicle, that is normal. And when we near to the lung tissue, we can hear a resonant sound. And when we can see this area it is covered with the hair tissue. So when we percuss here, we can also hear we can hear a dull sound. So normally we can get a resonant sound in the lung tissue, and a dull sound where there is a hair tissue, we can hear a dull sound. And when it is near to the stomach, we can hear a tympanic sound. Why we are hearing a resonant sound here? Above the clavicle there is the right upper lobe of the lung. Here also we can see right left lower upper lobe of the lungs. So in over the lung tissue we can hear a resonant sound. When it comes to the head tissue, we can hear a dull sound, and where it will come to the abdomen, we can hear a tympanic sound. So that's about the percussion. And in percussion, mainly we have to see 3 lines. It is called, first one, there is a line, imaginary line. This is called the mid-sternal line. So then the so in between the clavicle, this is called the mid-clavicular line. Then this is the anterior axillary line. This is the 3 landmark we are mainly doing the percussion. So next we are moving with the auscultation. So when we are analyzing the respiratory assessment, we have to do posterior as well as anterior as well as posterior. It includes in inspection of the anterior chest, palpation and percussion auscultation. Same with the posterior. So first we are going with the auscultation. Auscultation start with the neck. Neck. Here we are looking at the bronchial, like the bronchial sound. It's normal sound. Mainly we will get the bronchial sound over the trachea. It's a loud, harsh sound and it is high pitch. We will get the bronchial sound only over the trachea. Then we will start with the chest auscultation from there. I usually start with the right side above the clavicle here. Here this is the upper lobe of the lungs, right upper lobe. Here the left upper lobe of the lungs. Then below that Bob, can you take a deep breath? One more time. Okay. Bob, take a deep breath. So normally when we auscultate, we will get the bronchial sound in the trachea and over the lung tissue, bronchial sound over the trachea, and we will get a bronchovesicular sound in this region, mainly in the branches of the trachea, that's bronchioles, and in the lung tissue, over the lung tissue, we will get the vesicular sound. That's about the auscultation. So the right lung is divided into three: right upper lobe, middle right upper lobe, middle lower lobe, and right lower lobe. But in case of the left lung, there is only two lobes. The most of the part of the lung is covered by left upper lobe, and then there is only a small portion of the left lower lobe. And also, while we are doing the auscultation, there are some abnormal sound. It's also known as adventitious sound. That also we need to hear. So once again, I am doing the auscultation. Jim, please can you take a deep breath? There are mainly four types of adventitious sound: wheezing, stridor, crackle. These are crackle and wheezing. These are the adventitious sound mainly we are looking when we auscultate the chest. So now I am going to now only we finished with the inspection of the anterior chest. Now we have to inspect the posterior chest. For that, Bob, I'm now I need to inspect the posture. Will you be able to sit for a while? Okay. So in the posterior chest also, first we will start with the inspection. We have to look for the any like the color, symmetry, and any scars. Any scars or any kind of shape and symmetry. These are all the things we are looking for the inspection. Next we will do the palpation. So palpation we can start like this. So here we can feel the spine. You can feel the spine. We can when do the palpation, we can feel the spine. And also, Bob, when I do the palpation, please let me know if you have any pain. So you can palpate like this in both hands. And checking for any masses, any lumps, any swelling. And also, while doing the palpation, we can ask for the still symmetric lung expansion. So we can, it should be under the scapula. We have to hold it under the scapula, hold like this. And Bob, can you take a deep breath? One more time. One more time, can you take a deep breath? And also, while doing the palpation, you can search for the tactile parameters. So we can ask Bob, can you repeat 99? One more time, 99. One more time, 99. Okay. Now we have to do the percussion. Usually in the clavicle we will get the resonance. Now we have to do the auscultation. Bob, take a deep breath. Also, we can check the lateral aspects of the lung. So we can come like this. So in the lateral aspect, over the right side, we are looking at right upper lobe, right middle lobe, and right lower lobe. On the left side. That's all about the auscultation. Bob, now I'm done with the auscultation. Now you can lie down if you want. Now I'm going to the next session. If you have any discomfort, you can let me know, and I'm going to document these findings, and I will let the doctor know, and I will come after 30 minutes with the medication, and I'm placing the call bell near here. If you need any help, you can ring the call bell. Thank you.